I mentioned that's obviously, a huge concern for employers. Everybody's talking about kind of PBM reform. We're talking about transparency. We're talking, GLP-1s are still kind of a big cost driver for employers. There's the affordability of care. So, like, there's just all these things that are going on within the employer's world. What are some strategies and things that you're recommending for employers that maybe have brought their CEO to the table and are really concerned about the rising cost of healthcare and want to do something different to address these costs going into the next year?
We've seen some large organizations, especially those, let's say, that are private equity backed, looking very hard at reference-based pricing, looking at ICRAs, basically putting cost control and cost reduction, as a priority over attracting and retaining. And they're okay with the disruption. I think many employers are becoming, again, much more aware of some of these misaligned incentives that their broker or consultant may have, and they're doing a better job vetting that out during their broker selection process.
Hello, everyone. Welcome to Spark Spotlight. Today I have Nick Bellanca. Nick is a vice president with Lockton Companies out of the Ohio region. Welcome, Nick.
Thanks, Lindsay.
Looking forward to having you today. So today what we're going to talk about, Nick has worked in kind of the broker and consultant world for many years. He's got a ton of experience working with employers, knows really kind of like what's on their mind as we're going into 2026. And there are different strategies that more innovative, strategic brokers are really kind of deploying to work with their employers as they're seeing, crazy cost increases continue for like the next year, which has been, something that we've been talking about for years now. And employers are really, kind of struggling. And there's a lot of things that brokers can do to really help clients bend the cost curve, but then also really just help employers with thinking more strategically about their benefit plan design. And I think, we also have a lot of people that listen to this podcast that, come from the vendor side. So we want to make sure that we're explaining a bit about kind of that broker employer relationship and why that's really so key for vendors to also, work within kind of the broker world and work with kind of the change makers out there like Nick that we all enjoy working with. So Nick, if you don't mind, would you give us a little bit of background on yourself and your experience so that the audience has a bit of context?
Glad to. Yeah, thanks, Lindsay. So, Nick Bellanca, I'm the vice president with Lockton in Columbus, Ohio. I've spent time on the carrier side with a large life disability lead management carrier. I've also spent time on the point solution side with a vendor in the genetic testing space. And then I've spent the last 4 or 5 years on the broker and consulting side, working predominantly with middle market and larger self-funded organizations.
That's awesome. So I think it's great, Nick, that you kind of have this holistic experience. So you've seen multiple angles of the space. So you can really kind of speak to that. For the clients that you work with today in kind of the Ohio region and the Midwest, can you tell us a little bit about like what's a typical employer profile, in terms of size, industry, anything like that that can give a little bit of context?
Yeah. So predominantly working with clients, I would say anywhere from a couple hundred employees all the way up to the largest being around 10,000. So it really runs the gamut as it relates to size, industry. We have some in the financial services, manufacturing, healthcare, private equity, automotive. So, on the employee benefit side, we're largely agnostic. We don't specialize quite as much as our peers on the property and casualty side of things tend to. But really, our focus is those groups that are self-funded or for those that are very interested in moving to self-funded. And I'd say organizations that are looking to make changes and or they are growing, those are typically really good opportunities for us to provide value.
Awesome. Thank you. Well, then maybe kind of on, building from that. So working with self-funded employers primarily that are looking to kind of make changes. I think that as I mentioned in the introduction, that's very much needed right now as employers, again, are kind of facing these, crazy cost increases. And, everybody's talking about kind of the unsustainability of the system that we've built here. So as an employer is going out and looking for a broker that they want to work with, or I know that there are renewals and things like that, and they're kind of scanning the market, thinking through who should we work with going forward. What would you give in terms of advice for, how you can find, a broker partner that would be more strategic, really acting as more of a coach than maybe how some people have historically thought about things being more of a transactional relationship?
Yeah. So as it relates to employers selecting a broker in the past, it's been very relationship driven. And I think today it's still very relationship driven. But, there needs to be a relationship, and the broker must be trusted. Their team must have expertise and the ability to deliver the resources, beyond insurance as well. So I think many employers are becoming much more savvy and sophisticated as it relates to how they're selecting their broker. I mean, we've seen selections by committee as a common process over the past year, in particular, where the chief admin officer, chief legal counsel, COO, CEO, in some instances, is involved in these broker reviews and the decision. So I think it's quickly evolving just due to the fact that the costs are rising so quickly. And then there's a big focus on governance and fiduciary responsibility. So I think many larger self-funded employers are now acutely aware of the need to have a governing benefits committee, and that's shaping how frequent they're conducting broker RFPs and what that broker evaluation process looks like.
I think that's key to what you said about bringing in C-suite executives, including the CEO. What I've seen in the past is whenever you get people at that level in the organization involved in the benefits, things, like new opportunities open up. They think about things in a less traditional way. They're much more strategic, and it's more likely to, have probably a positive impact. So I think that that's great that you are seeing that in market, and probably something that Lockton would recommend as well, right?
Yeah, 100%. I mean, I think one of the key aspects to choosing a broker and kind of what that broker experience is, and where I think some employers have felt burned a little bit, is if they have a broker who's selling product or pushing product, and sometimes it's their own broker created solution. And in many instances, those are ones that have additional hidden revenue streams. So I think many employers are becoming, again, much more aware of some of these misaligned incentives that their broker consultant may have, and they're doing a better job vetting that out during their broker selection process.
Yeah, I feel like that's been like a super hot topic. I just got back from Rosetta Fest. We were talking about fiduciary responsibility and, transparency and incentives in general. And so I think when you think across the whole industry, there's just a lot of awareness around misaligned incentives and how that doesn't necessarily benefit the employer or the employee as well. We'd love to kind of hear, how Lockton approaches that from like more of a transparency perspective, and how you're working with employers to make sure that that incentives are aligned so that you can really kind of act in the best interest of those employers.
Yeah. So I think, Lockton's differentiator holistically is the fact that we are independent. We're the largest privately held, family owned brokerage in the world, which is great. It means we're not tied to Wall Street. We're not tied to quarterly earnings. We don't have any private equity. We're not focused in on margin expansion. So we truly invest back into our associates and our clients and our communities. And we remain agnostic as it relates to the solutions we bring to the table. We don't have our own pharmacy coalition. We haven't built our own captives. We aren't selling products that we've created. Again, that allows us to stay agnostic and really understand the client's needs and putting their goals and strategies first, and then aligning the solutions that are the best fit for them. And again, solutions where if there is compensation and incentives for us, it's made transparent up front. And that has been a differentiator for us, especially due to everything you just mentioned around, the scrutiny on misaligned incentives, hidden compensation. So being very transparent as it relates to, hey, here's what we're doing, and here is our proposed compensation for the work that we'll do. And, making it as cut and dry as we possibly can.
Yeah, that's awesome. And that's what I've heard about Lockton as well. I totally agree. I think that that's very much aligned with kind of what employers are looking for today and really kind of how everybody's looking to operate in this system as well. I think going into 2026, so, I mentioned that's obviously, a huge concern for employers. Everybody's talking about kind of PBM reform. We're talking about transparency. We're talking, GLP-1s are still kind of a big cost driver for employers. There's the affordability of care. So, like, there's just all these things that are going on within the employer's world. As you're looking into 2026 and working with the employers, they're self insured within kind of your book of business. What are some strategies and things that you're recommending for employers that maybe have brought their CEO to the table and are really concerned about the rising costs of healthcare and want to do something different to address these costs going into the next year?
Yeah. So I think, going into this open enrollment season, it's been a continuation of what we started to see last year was the interest in alternative funding strategies continuing to rise, reference-based pricing, variable copay plans, ICRAs. We saw a ton of interest, but very low adoption. And we are starting to see the actual adoption of some of these more aggressive strategies rise. I'd still say there's a lot more kicking of the tires than actual change that's occurring. But, we've seen some large organizations, especially those, let's say, that are private equity backed, looking very hard at reference based pricing, looking at ICRAs, basically putting cost control and cost reduction as a priority over attracting and retaining. And they're okay with the disruption. They know there's going to be disruption. It will help with the analysis. And you can get creative as it relates to reference based pricing and ICRAS as it relates to bifurcating it as it relates to like the states or potentially the classes that you would roll those strategies out to, which is something we've been looking at for many groups that are interested in it versus doing more of like a full line change across the board, looking at carving it up as it relates to, okay, hey, this state makes sense for an ICRA or these three states, or maybe, the employees within this class would be a better fit for reference-based pricing than the management and executives. So there has been extreme interest, especially from cost conscious employers, again, those that are private equity backed in particular, around, okay, hey, we're ready to take some very aggressive steps towards controlling our costs so that we can maximize our enterprise value if and when we transact over the next 12 to 24 months.
Yeah, I mean, I think that makes a lot of sense. I think that a lot of employers just can't really continue to absorb these costs. And I think it's interesting that you mentioned, that some employers are thinking, prioritizing that over employee retention. We've obviously heard about employee recruitment and retention for many years. I think as the labor market has shifted, that's probably, given employers a little bit more flexibility and how to approach that. But curious, as you're working with employers that are kind of rolling out some of these alternative funding models and really looking at more aggressive cost containment, ways of thinking, how are they rolling this out where it will minimize disruption across employees? I know that you mentioned looking at different classes of employees differently, but is there some sort of like communication strategy that you're seeing that's working really well? Or, kind of how are they rolling this out to employees to kind of minimize the disruption?
Yeah, it's a great question. I think it's low hanging fruit in our world in the employee benefit space around just enhancing communication and education holistically. But especially if you are making significant changes, for groups that are going down that path of, I mean, it's no different than when high deductible health plans were first being rolled out. That felt like a massive change, right? And the strategies that were employed then can still work now, just as it relates to providing employees the opportunity to have a one-to-one conversation with a benefit counselor who can help that individual. And many times their spouse will be on that call or in that meeting as well, helping them understand, hey, here's the plan you've been enrolled in. Here are the options as we move forward. We can help map you to the most similar plan, or let's dig in a little bit deeper as it relates to how have you utilized healthcare over the past 12 to 24 months? Do you have any planned surgeries coming up over the next 12 months? What will healthcare look like for you based on what you know today? Helping those individuals make the right decision for them. And so many employees have never had that type of conversation with a licensed benefit counselor. It's usually been communicated through an open enrollment guide, a PDF. Maybe they'll get on a Zoom call. Maybe they've gone to a group open enrollment meeting, and they're just not being engaged in the way that we're all used to being engaged, right? We're in this, you know, TikTok environment now where like none of us can compete with the billions of dollars being poured into social media. So like, how do we actually get the attention of our employees around something we're spending a lot of money on, which is their insurance and benefits programs? And that's where we are heavily emphasizing one-to-one communication. Then you can augment that with videos, PDFs, decision support tools. There's some new AI tools that are out there. But I do think during new hire onboarding, and open enrollment, whether you're making significant changes, but in particular, if you are making significant changes, work with your consultant and or a third party enrollment firm if you're large enough to provide that one-to-one, white glove hand holding experience as it relates to benefits. Because people need that help, and benefits are so personal. You can't cover all the bases in a PDF. You can't cover all the bases in a video from the CEO. It needs to be a one-to-one conversation.
I guess follow-up question on that, so we work with a lot of vendors who, are selling into this market, and they're oftentimes not super familiar with the importance of driving adoption at the employee level. As you and I know, this is kind of like the world that we're working in as a B2B2C environment, where the C is the actual, employee and their family who's going to be using the benefit. So, there's obviously different ways to kind of get your product kind of wrapped into the employer's kind of holistic world, depending on the type of solution. But are there any strategies that you've seen that are like smart from the vendor side that would be, maybe it's something a little bit more unusual or something that's well received from the employer to really kind of wrap their vendor solution into the employer's world to make sure that they're driving that level of adoption?
Yeah, I think depending on your solution, you need to be really creative and targeted. So again, depending upon the category in which you play in, figure out like where you can provide that, I call it, a just-in-time benefits experience so that those people who can most benefit, those people that can see value in what you're providing, can take advantage of it when they need it. And the sad reality is most people don't even engage with benefits throughout the year, right? Unless you have a significant health issue. And when you do have a significant health issue, you just want to be well. Like all this insurance, all these benefits, people calling your cell phone, it's a lot for people who are going through a health condition to manage. So I think it's being really thoughtful about how you engage throughout the year with the employees that could potentially gain value from whatever type of point solution you're providing. Just so like, again, you have some broad, hopefully, education or awareness so that if that time ever comes where that person is diagnosed with cancer or they're going through a musculoskeletal condition, they'll know, hey, okay, this is my MSK vendor, or okay, this is the cancer navigation program that's available. So at least hopefully that name will be familiar to them at that point in time. But then really getting good as it relates to the proactive outreach to the individual, or if you can get the outreach coming from one of the providers to the member, that's key. And then obviously the employer, hopefully providing easy to access resources or even proactive resources to that individual as they're going through that significant health condition. And I think a lot of missed opportunity in many of these scenarios is educating the spouse as well, because many times the spouse turns into a caregiver depending on the health condition. And if the spouse is aware of, okay, we have this navigation program through the spouse's employer who's going through the health condition, like let's engage with them. They can help with the billing. They can help ensure we're going to the right provider for this specific care. They can help us get a second opinion. So there's no silver bullet, unfortunately. I think it's a lot of communication, strategically throughout the year, maybe tying to specific events that the employer is putting on, or, breast cancer awareness, month, if you're a cancer related solution, right? Like just, again, promoting that awareness, but then being very good at getting in touch with the member and probably their spouse, more importantly, at the time a serious condition arises where that person could, receive value from the program that you're offering. And then, I mean, I think carrier integration is critical. I've seen value on both sides of that spectrum as it relates to not being integrated versus being integrated. I'm starting to see the pendulum swing back towards my thinking being, yeah, carrier integration, TPA integration is extremely valuable as it relates to point solutions.
Yeah, I totally agree. I mean, that's kind of what we preach to our clients as well. So I appreciate you outlining that because I think a lot of time, again, a lot of vendors are thinking, oh, well, let's, kind of land the contract with the employer or, whatever their gateway is to get into the employer. And then they're not thinking as much and as critically about kind of that downstream adoption. And as we all know, if the solution is not utilized, you're not going to get anywhere within this world, obviously. So
Yeah.
I guess so, right now is Q4, or well, I guess we're about to be in Q4. And, there is a natural kind of planning and buying cycle within the employer benefits world. Would love it if you would just maybe talk a little bit about, October, November, every year for an employer, what it is they're thinking about, what it is they're focused on, obviously open enrollment, but like strategic planning, how they're thinking about decisions, maybe kind of going out into the next year or the following year or even longer in the future. And with maybe like you were talking before, you work with groups from 10,000 to 10,000 lives to kind of smaller groups, maybe how that differs based on the size of groups that you're working with, because I know that their level of maybe complexity in terms of their benefits planning is very different.
Yeah. Glad to talk through that. I think it's a little bit surprising. There are some groups that are 800 lives that have a much more organized and maybe even sophisticated decision-making process than a 5,000 life company. It a lot of times just depends upon the industry and the culture of the organization. Typically, though, yeah, the larger organizations are going to be making their decisions sooner. So as we sit here, September 30th, 2025, if groups have not made renewal decisions for 1/1 in their large groups, they're late. They're scrambling probably this week to get these decisions done, so they can begin implementations. They can finalize their budget for 2026, and they can begin to plan for open enrollment. So it is an extremely hectic time for any larger organizations, and I would say 1,000 lives and above. Again, hopefully they've already made decisions and now they're getting into implementations and planning for open enrollment, but they're probably stressed out. So if they don't return your call or email right now, don't take it personal. They're just very busy. I will say, the smaller groups call between like 100 and 500 lives. Many of them, if they haven't made decisions, will be. They're probably just a couple weeks later in the process, just because they can be more nimble around open enrollment, and maybe it doesn't take as long for them to get changes approved and implemented and communicated for open enrollment. But I would say, this is the time of year when groups are, they've made their decisions and they're gonna have to live with those decisions for the next 12 months. And, I haven't seen an organization out there where it's like, hey, we've made all the changes we thought we were going to change. We've made all of them. Usually there's one or two things, right, that are being pushed to next year. Usually the laundry list of priorities is pretty long. They'll narrow it down, make some decisions, make some changes, and then reevaluate going into next year. So there's always going to be things on that list, I think, for proactive benefit managers and decision makers to work on to improve, especially in this day and age when the costs, again, just continue to rise. And there are a lot of different solutions out there, and there's new solutions that pop up every day. So I do think talking to benefits decision makers shortly after open enrollment is a great thing to do, because benefits are fresh in the mind of the organization. Maybe enrollment didn't go as well as they planned. Maybe they've decided, hey, we need to make some changes. That isn't exactly what we had in mind for this year. And it's and it's an opportunity to talk through, hey, what changes did you made? What changes are you still evaluating as you move into 26, 27? And I think the big key thing here is data. I mean, I think for all of these self-funded employers, they're leveraging their data is critical, and I think some employers and some consultants do a better job than others actually utilizing their data, being predictive, being proactive with leveraging their data to actually be able to measure the plan's effectiveness. I was at a ISCBS symposium a couple weeks ago, and there was a whole session on benefits measurement. And the takeaway is most organizations are not doing a great job in measuring the effectiveness of their benefits program.
Right.
The most common answer was, the question was, how do you measure your benefits program? The most common answer in the response to the survey was based upon the elections that the employees make.
Oh, wow. Yeah.
So it seems like
Seems
there's
like a great opportunity for new innovations, right?
100%, 100%. And then the other key thing is with all these new innovations, like how are we measuring the success of the program, right? I
Mhm.
mean, there needs to be KPIs, there needs to be ROI. You need to be able to clearly articulate to the C-suite, hey, we invested in this program. Here's the financial impact it had on our overall healthcare spend.
And I imagine that's an area where Lockton helps clients, right?
It is. Yeah, we're unique in that we've owned our own data platform for years. It's called InfoLock. So it houses data for over 5 million lives, I believe. And it provides us the ability to bring a data warehouse, a data engine to each of our self-funded clients so that they can leverage all of that information along with their own employer's information to be more proactive and to measure the impact of any strategies that we implement.
Yeah, I think that's great. I totally agree. I mean, I think that, just in this environment, there's a huge opportunity to be more strategic. And I'm not really sure how you do that without having kind of access to your data and really, having a more sophisticated approach to how you're reviewing that. But as we all know, many of these employers don't have the in-house resources to do that. So they're going to rely on partners like Lockton or perhaps, new vendor innovations that can actually help them kind of look at these things, especially if you can't always trust maybe what you're getting from like your carrier or somebody. So I guess in closing, as you're thinking forward to 2026, we talked about alternative funding. We talked about like ICRAs, reference-based pricing. We talked about cost increases for employers. But are there other benefits that you are seeing that are trending amongst employers that might be something that is a little bit different than maybe what we saw in past years, or something that you think would be interesting for the audience to hear about?
Yeah, it's a great question. So, from time to time, new benefits do pop up. Well, here's one that I think is really cool. It's more of a financial wellness program. I'll mention the name. It's called Previ, Previ.
Okay.
And basically, it is a cell phone contract, an enterprise cell phone contract that employers who choose to offer it can extend significant pricing discounts for T-Mobile and AT&T.
Hmm.
So it can save any employee and their families who sign up for either AT&T or T-Mobile. It can save them $1,200 to $1,300, I believe, or maybe it's $1,100 to $1,200 per year
Wow.
through that program. So it's just like, and the great thing is there's no cost to the employer,
Mhm.
very minimal work for rollout. So it's just like an easy button as it relates to making it available and providing savings to employees. And you kind of do the math. It's kind of like, hey, you just gave everybody a $1,800 raise
Yep.
roughly by making this program available. So that's one again that just kind of caught my eye, and we've had a few groups roll it out with success. But I think kind of the trend I've seen as it relates to new solutions who've had success is they can quickly articulate the problem and maybe educate you on the problem in a different way
Mhm.
that their solution can help solve, and it can easily be implemented. There's an ROI, and they work well with both the employer, the broker, and the Ben admin technology if there is a need for technology. So it's kind of like I've seen like that recipe work really well, regardless of the specific solution. It's really more of like what's the successful recipe for some of these new solutions in the employer market? They can usually check off all those boxes, and then those are the ones that are able to scale pretty quickly.
Love it. Yeah, I totally agree, Nick. And I know that you've shared some of your feedback with some of our clients as well, but that's, very similar to like what we're telling our clients in terms of what they need to do to kind of differentiate themselves from a messaging perspective. And I think it's super cool that you called out financial wellness. I've been hearing about that from a lot of people, especially as, people are talking about, oh, well, employees can't absorb, these cost increases. But if you can give them other tools to kind of defray costs in other areas, well, that's kind of a win-win for everyone. So we've also seen kind of the rise of some of these financial wellness tools that maybe wouldn't have been on like the radar of like the benefits world so much in the past, but now, have some pretty cool things that they can do to, again, make things a little bit easier for employees as, they're kind of being asked to, absorb some of these costs or move into some of these more aggressive plan designs that, have more cost containment. So I think that's a great call out.
Yeah, it's like how can you soften the blow? So if you're delivering this negative, potentially negative message around, hey, we're increasing contributions, or we're sending you to the exchange, here's your new ICRA plan. If you can soften that blow with some other programs, especially financial programs, I think it tells a much better message, and it still shows to your employees that you care
Mhm.
versus putting, costs above culture, which again, many organizations need to do. But I think there's a way to do that without totally disrupting your most important asset, which is your employees.
Yeah, for sure. And every organization's different and they all think about this differently. So again, that's why it's important to have somebody like you working closely with them to kind of understand, the character and the culture of the organization and making the right decisions and recommendations that will work for them. So well, awesome. Well, thank you so much, Nick. I really appreciate you joining today. This has been really interesting. So, hope everybody enjoys watching the episode and hearing a little bit more about, kind of how you can think about really better partnering with kind of brokers in more of a strategic way. And I think that these have been some really great innovations and ideas that you've shared with us today, Nick. So, appreciate you joining.
Of course. Thanks, Lindsay.